Hi, it's Dr. Brian McDonough. Welcome to a special edition of Executive Pulse. My guest today is Jerry Penso. He is the president and CEO, and he is I would say, someone who has dedicated much of his career to AMGA. You've had many roles: chief medical officer, chief clinical officer, and now obviously in the top leadership role. It's an honor to have you with me.
Well, Brian, it's great to be here, and I look forward to a good conversation.
One of the things that I love about this program is we get to talk about healthcare issues, but in many cases at the executive senior level. And many of the people I speak to and have already spoken to also have been in medicine at many levels. You're a family doctor, you've seen it from all sides. And one of the things when we decided to do this program you wanted to talk about was integration. Now, for some people, you may know integration inside out. Others may not know what we're talking about. So let me start with you, Jerry. What is integration and exactly how is that impacting medicine?
Well, that's an important question because integration is one of those vague terms. It's like value, and people use it, kind of throw it around, and it may mean different things to different people. I'll tell you how I look at it. Over the last decade, there's been a massive acquisition by hospital system of physician practices. So now, under one roof, if you could say under one P&L, the physician practices and the hospitals are operating together. And the question is, how well is that going? Are they behaving as one system, or are they behaving basically as their legacy systems? Here's hospital one, hospital two, hospital three, physician practice one, physician practice two, physician practice three. Or are they gaining some of the efficiencies and maybe some of the effectiveness that they can gain from behaving like a true system?
So when we look at it that way, obviously there were some positives when this all started. There was the thought there's strength in numbers. For instance, if you're negotiating with an insurance company, you may do better if you have more patient lives. You might get better rates, or perhaps in pharmacy, you might get better contracts. And that seemed like it would be an incredible idea. But there's a phrase out there saying acquisition is not integration. And you kind of led to that there's a difference there. What are some of the problems we've seen right now? We know the benefits, the bonuses, but what are some of the problems as you see them?
Okay, we're going to start with problems then. The problems are number one, that integration doesn't work. Perhaps there's not a melding of the culture, and usually it's a leadership issue. They're just not communicating well. They haven't set aligned goals. They really haven't set a structure so that they could work together effectively. So these two systems behave perhaps as they used to. And you don't get the efficiencies, and you don't get the clinical, the operational, the financial results that you want to. And at the end, sometimes you get just a lack of trust. And I would say at the systems that I visited that don't behave like systems, at the core, there's just a lack of trust between what is usually a very strong physician culture and also a very strong hospital culture. So the question is, how do you meld those two in a way that makes sense? And by me saying making sense, I always look back at the patient. What really makes sense from a patient standpoint? Can we lower the cost of care so healthcare is more affordable? Can we make sure they get the highest quality possible? Can we make sure they have the access that they need? To me, that's when integration really is working, when the patient notices, gosh, this is much better for me.
You're alluding a little bit to what different systems are doing and when they're doing it well, and you get to see them, from all perspectives. When they're doing it well, is there a difference in the relationship between the physicians and the executives? And one of the things that in this program, Executive Pulse, we've talked about is that sometimes physicians don't respect administrators and administrators don't respect physicians. They kind of go back and forth, and they're not aligned because they truly say the right things, but they don't necessarily believe it. Have you come across that as well?
Oh yeah. I had a great interview with Todd Smith. He's the chief physician executive of Sutter Health out in California. And he said the core issue is trust. And the core issue often is language, that often the administrators on the system side will speak certain language and have certain words, and the physicians have a different language. So the best systems that I've seen have formed what are called dyad leaderships. You put an administrator with perhaps the system and business knowledge together with the physician executive who has the clinical and also operational knowledge as well, put them together, and they have to learn each other's language. They have to translate often. The physician maybe has to translate to the physician community that he or she represents, hey, this is what we need to do as a system to succeed, and vice versa. The administrator on the administrative side says, these are issues that are important to the physician community. How do we build those into our processes and systems? So one, I think it's a language issue. Two, I think it's a trust issue. And three, I just think it's often building the infrastructure so that the best outcomes can happen. And I'm going to push back on you because you have a experience in electronic health records and digital health. One of the issues is, do they have good infrastructure? And one of those things is a common EHR. Without a common EHR across the system, it is just almost impossible to do the kind of things that you need to do as a system. So many systems are moving rapidly. Even if they have, for example, Epic as their system, they may have different instances of Epic so that system A really can't interact and communicate well with system B in an efficient way. So many systems are spending the time now rebuilding their electronic health records so that across the system, there's one instance of Epic, and then they can gain the advantages of having that common platform.
No, you brought up a great point there. I mean, I've seen it all. We started out with paper, went to Meditech, with our institution with Meditech to Cerner to Epic. I remember one of the first conferences where we were talking about these things. I had an opportunity to be there, and I said, why don't we just pick something that's out there and all go with it? And the speaker just laughed at me and said, you don't understand capitalism, doctor. We all have to get 50 companies, whittle it down, everybody will make their profit, and then eventually we'll get to the one. And I was kind of frustrated because I'm like, but this is healthcare. These are patients' lives, and why are we, treating this like we're car dealerships, and we are getting to that point now where people are more or less getting to this, they're recognizing that value, as you say, not just the same system, but having the same tools in it, because without the same tools, you lose the standardization and you lose the data. And that's also very important. Mentioning that and talking about integration, and since we're talking a little about electronic medical records, there are so many physicians who are upset about pajama time and the fact that their life seems so much harder than it ever was. And it's hard to use these tools. And then the second thing they're upset about is it appears that these tools were sold to the C-suite to look about coding and finance, but not necessarily getting the tools you need for care and to improve care. Do you see that changing? Do you see that being recognized as an issue?
Oh, huge issue. AI is one of those new technologies that's out there that has huge promise, but also can lay bare the inefficiencies of integration gone wrong. So if you have a system where you don't have a unified AI governance and a whole tech strategy that you can implement across the system, boy, you could spend a lot of money and waste a lot of time. And actually, at the end of the day, frustrate a lot of your clinicians and your workforce. So what we're finding is, number one, it's a huge challenge. It's a huge challenge because the technology is evolving so quickly and the need is huge. The need for making physician lives, patient experience better is huge. And the promise of AI doing that is there. So the systems that are working the best at AI, first of all, have a really good AI governance strategy. And it's one of those things where you have to move fast and move slow at the same time. You want to move fast and implement things that make sense and have an ROI and can really improve both the finances and the patient experience. But you want to move slow as well, because what I understand is many of these executives, the CEOs and the COOs, are getting hit 50 to 60 vendors coming every week to visit them, to tell them, hey, we've got a new product that's going to make your revenue cycle or your access better.
Hi, it's Dr. Brian McDonough. You are listening to, we're watching Executive Pulse with my special guest, President and CEO of AMGA, Jerry Penso. We're talking about integration and how perhaps the future of medicine may get better if we do these things right. And we're talking right now about AI, which is clearly the future of medicine. You bring up a great point, and that is that so many of these physicians and others have their own needs in their own area and they want it. And then administrators are being told, yes, we can do that. I will say this, one thing I learned as a CMIO over the years is they always say we can do that, and they can, but there is a fee attached to we can do that. And I didn't realize that right away.
But I think that's life in our economy. That's economics 101. You can't get everything you want. So having that trust at the core, so that the physician who wants that extra MRI or the extra gamma knife or whatever it is, the technology, whatever, there's another area where integration is challenged. And true integration, if it's working, really deals with the issue of capital deployment. There's a strategy, there's, if you will, alignment, and there's good communication between the clinician community, the physicians, the APPs, as well as the administrators in the hospital system, so that when the capital is deployed, everyone understands what the strategy is and why certain things were approved and certain things weren't approved. So I put it in the same bucket. It's in that integration, and if true integration is working, you're deploying your capital together. You're working together to, decide your future.
One of the things that always bothered me, most of us and many people who are watching, listening to this have been through various committees as physicians, especially, was serving on medical executive committee when the CFO would come in and talk about finance. And as a family doctor, they would talk about their losses in ambulatory medicine. And, you'd have all this money and then there's losses, like we were just dragging down the organization. And they never really talk about downstream revenue, the use of wise use of consultants, how well you're doing with your ACO, all these things. It would just be thrown at you guys were losing, but without the providers, the family docs, the internists, those people, the hospitalists, things don't get done. How do you rearrange the way that's discussed? Because anytime I've been on these committees, and I've talked to others in other organizations, it's always presented the same way. It's as if the cost of the physician is a negative. You don't see that when they say the cost of the basketball player in the NBA is a negative, or the Major League Baseball player. But for some reason, physicians are not seen many times as talent or as the people that need to be more or less taken care of and appreciated.
Well, Brian, we have an accounting issue. And I think at the core, if we had one giant P&L for the system, we'd look at it completely different. But because these systems came online as separate entities, and there's probably legal and accounting reasons why we have separate P&Ls, that's why we look at them differently. So if you take the P&L of a physician enterprise and you strip out what used to be part of an independent physician enterprise, and that would be the ancillaries like the laboratory and the x-rays, which used in an independent practice would go into that P&L, but bring that back to the hospital system, well, then the hospital system P&L look very different, as well as the physician enterprise P&L. So I think what's important is to really think about it from a patient experience standpoint. Patients move horizontally through the system. They see ambulatory care. They see their ASC for their surgery. They see perhaps your hospital outpatient facilities, and they also see your inpatient facilities. So patients don't move in one single part of the system, but they move across. And your accounting really has to account for that and look at it as a holistic whole. So I think that's where the more sophisticated systems are looking. You have to look at, gosh, why did we acquire physician enterprises and physician practices in the first place? And what is the value, the total value, not the single accounting P&L for that system, but the total value that accrues to the entire system?
I'm with Jerry Penso. We're talking about integration, and obviously have gone into other key areas. It's very complicated, but you're going to do something at AMGA, I believe, in the fall. You're going to have an integration summit. Tell me a little bit about the integration summit and what the goal will be.
Well, I'm very excited. This is the first time we're doing it, and we labeled it integration because we believe that that's a pain point for these systems that have rapidly accumulated hospitals and physician practices. We think there's really opportunity for them to work together in an operational way, in a way that is problem solving. So we've designed this conference for teams so that the C-suite, the CEOs, the CFOs, the COOs, the CMOs can come together and work together to solve some of the vexing issues and hear from other peers what's working, what's not working, and then sit around the table and talk about how we're going to implement those things, whether it's the financial pinch because reimbursements are declining and workforce and other expenses are going up, whether it's access to care. We know that's a huge issue with physician and clinician shortages, whether it's AI and deploying AI and technology in a way that makes sense and really getting an ROI. Those are the kind of things that we're hoping comes out of the conference, and also just clinical care. How do you organize service lines and clinical care across the system in a way that gets the best outcomes? Those are the conversations that we're going to have. We're going to make it very team-based. We're going to make it very problem-solving orientation so that people come away with what I call wisdom. Wisdom I call what I shall do on Monday. They come away with one or two things that they can implement on Monday back at their home institutions.
No, that's a great idea because you're getting people speaking. I was recently at your conference in Las Vegas. It was fascinating to see how people come together and how they talk to each other and they're sharing ideas. Because let's face it, I would think if you're a CEO of a hospital, God help me if I ever became one, that's a lot of work, but also they feel isolated. There's not that many people they can talk to, but if you can talk about problems, you can share things and also talk about new ideas. And that leads me to really my last question, the most important question, I think, is we started off talking about the problems. Then we moved to some of the good things and we've gone back and forth. Where do you see the future? And also, what do you see as, from your perspective, one of the best ways to get us to a much brighter future as opposed to sitting there and saying we have problems?
I think the two main issues facing healthcare right now is affordability and access, and they're linked together. Affordability, I see a bright future because I believe with technology, with the best use of our care teams, everyone working to the top of their license and organizing as a system, there are a lot of efficiencies that we can get out of the system that will make healthcare much more affordable. The second thing is access. I think, again, we are entering a new era of access. The old model was, hey, I had to call on the phone, ask for an appointment, and they would say, hey, yeah, we can get you in 3 weeks on Tuesday. Now with technology, we can have virtual visits, we can have e-visits, we can have bots, we can have AI-guided care, we can have urgent care, we can have, so getting the patient to the right care at the right time in the most efficient way, I think is a great frontier. So I think quickly, in the future, and I mean 2 to 3 years, I think we're going to see major advances in affordability and in access.
Jerry Penso, CEO and president of AMGA. Anything else that I did not ask you that you'd like to talk about as we wrap it up?
Well, I think underlying many of these systems, the issue is culture. And culture, again, is one of those vague terms like integration. But you know it when you see it. And you know the different cultures of the organization, and that starts with leadership. Is this a culture driven by purpose? Is this a culture driven around, hey, we want to give the best care that we can to our patients and to our communities? And at the core, if you've got that healthy culture, I think integration is going to work.
What a fascinating conversation. I appreciate you sharing your ideas and knowledge and years of experience with us. You kind of put it all together. I really appreciate your time too.
Brian, it's been great talking with you.
Thanks for watching Executive Pulse. Remember, we're here. You can find us. We got lots of exciting programs. Looking forward to continuing this and having some great conversations going down the line. Thanks for watching.